Just thanks. We're going to switch gears to talk oral health. Severe tooth pain and dental emergencies don't stop happening because of a pandemic. Some may still be worried, though, of visiting a dentist. Close quarters here, but ignoring tooth pain will only make your dental issues worse. That's what we're hearing from Dr. Alan Gluskin. He is the president of the American Association of Endodontists. Doctor, thanks for being with us there this morning in San Francisco. Talk to us first about the difference between an endodontist and a dentist.
An endodontist is a dentist, but goes to school for an additional 2 to 3 years to learn the specialty of endodontics. Endo means within, and dontics obviously is teeth. Within the tooth, we deal with the nerve of the tooth, the blood supply of the tooth that forms it when you're a child, and then likely, hopefully stays healthy in your lifetime, but can get infected, can give you a toothache, can wake you up at night out of a sound sleep, or cause swelling in your face. We are specialists that treat that kind of degeneration in teeth in order to save them and cure them and get you back to health.
Okay, so not all dentists are also endodontists. Let's talk a little bit about what constitutes a dental emergency. I'm thinking you just described it, that kind of pain that wakes you up in the middle of the night. When do we definitely need to, put concerns aside? I mean, address them, but go see the dentist when it's necessary.
Well, an inflammation in a tooth can turn into a very difficult infection. And while it may seem, I'll just have the tooth pulled, you shouldn't really do that for the key teeth in various positions in your mouth. You should try and save your own natural dentition. So if it's a situation where the tooth is highly infected or highly inflamed, you want someone that won't hurt you, that is specialized in pain control. You want someone that'll do it right, who is an expert at treating root canal treated teeth, so that you don't have to have it done a second time. Going to an expert who's had the training is to your advantage and has the highest likelihood that you will keep that tooth for the remainder of your life.
Well, so what would patients expect then when visiting a dental office, given those circumstances?
Well, endodontists use techniques that are very sophisticated. 100% of endodontists use microscopes. When you can look down into a tooth and magnify it 10 to 20 times, you're going to see all the complexities within that tooth that you need to find in order to treat the tooth successfully. We use three-dimensional imaging that goes around your head so that you don't have to have x-rays placed so deeply into your mouth. And the three-dimensional imaging allows an endodontist to see the fine complexities and the angulations of the roots and the way they turn forward and backward in the jaw. We also use 100% of the time a rubber dam. A rubber dam is a rubber sheet, very light, that goes over the tooth that's being worked on so that the aerosols in your nose and mouth aren't you don't breathe them onto the staff, the dentist, and the dentist who's breathing with a mask on and staff with a mask on has no chance of getting aerosols onto you. So those three things alone, and the sophisticated instruments that we use, single use, we use them out of the package and throw them away after they're used on patients, really makes your visit hopefully painless and one that will allow you to keep your tooth for a lifetime.
Dr. Allen, I'm glad we were talking to you about it, but really an uncomfortable conversation for a lot of people who, want to avoid the dentist like the plague. Thank you very much for your time. I'm going to send it over to our meteorologist. You seem to be paying really close attention.